I'm Dr. Barbie Sullivan with the Women's Clinic, OBGYN. The Da Vinci robotic system is a system designed to help physicians do surgeries like hysterectomies more efficiently, and really it helps us be able to take patients who are who would traditionally have to have an open surgery, a big incision on their abdomen, and take those patients and now do them laparoscopically, which is what we would term minimally invasive surgery. And with the Da Vinci robotic system, what I see is high definition, which is sort of like looking at your plasma TV, your big screen. It is 3D, so it has depth, and it is 10 times magnified, so I can actually see better through the robotic system than I can see if I have a patient open. This method's a better way to do hysterectomies in most patients because you can do their hysterectomy through smaller incisions. They have less blood loss, less infection, less pain. Most patients go home within 24 hours of the surgery and are up doing fairly normal activities within a couple of weeks. Almost all patients are back doing normal activities in 4 weeks. It's not run by a machine. There's not anything that's on autopilot. The Da Vinci robotic system is performed, the surgery is performed by the surgeon who's actually sitting at a console, but their movements are translated by the machine into smaller, more precise movements. It actually can take a tremor out, so most of us have little tremors or that kind of thing, and it can take that and actually minimize that by the time it gets to what's the surgery that's actually being performed. I like the Da Vinci robotic system mostly because it allows me to take patients who I used to have to make an incision on their abdomen, and they'd be in the hospital for 3 or 4 days and be off work for 6 to 8 weeks. I can take that same patient and do their many times and do their surgery with the Da Vinci robot, and their recovery time is shorter. Their need for pain medication is much less, so they have less bowel issues after surgery. Most patients are up, doing their normal activities much quicker. I like the fact that I really can see better using the Da Vinci robot because the light source is attached to the instrument so that I can put that right down on the area that I'm operating on. It's magnified 10 times, and what that means is that I just can see down to fibers and vessels, really that I can't see with the naked eye. Initially when patients come in for this surgery or for a hysterectomy, or if they get to a point that we feel like they need a hysterectomy, we start talking about the Da Vinci robotic surgery. Most people's initial response is kind of futuristic, and it is, and some people are all for that. Some people want every kind of high-tech instrument they can get, but I have a few patients who are a little bit wary of that and feel like that may be something that they don't want. But after surgery, almost all of the patients just really, they do so well after surgery. They need so little pain medicine. They go home quicker, get back on their feet quicker. After surgery, pretty much across the board, people love it. Not anyone can do Da Vinci robotic surgery. There's some pretty extensive training that goes that you have to go through before you're qualified to do that. In the end, there's a certain number of cases that most hospitals require you to have before you can do the robotic surgery alone. The sort of rule of thumb, if you talk to most people who do robotic surgery, they'll tell you 20 cases is where you really start to feel very comfortable with it. I've done about 80 cases now, and I feel very comfortable with it, but I still feel like on a lot of cases I'm learning. I'm able to do more technically difficult cases, but that's only because I've been able to learn on some of the easier ones. And it's just a great fun way for me to do surgery, and it definitely benefits the patient.